Good morning, everyone. Hope the studying is going well and good luck on finals. This presentation is brought to you by Bach and Cassandra. So today we'll be presenting pediculosis. What is pediculosis, you might ask? It's an infestation of lice somewhere in our body. These lice feed on our human blood, and they also lay their eggs and excrement, which is otherwise known as waste or poop. So there are three types. There is pediculosis capitis, and pediculosis corporis, and pediculosis pubis. So pediculosis capitis, otherwise known as head lice, are infested in our scalp. The female lay their eggs close to the scalp, where they become firmly attached to the hair shafts in our head. The most common areas are the hidden areas, which are behind the scalp and behind our ears. Children are most commonly affected by this since they are least protective of their personal space and they're more likely to share their personal items. The next one is pediculosis corporis, which is otherwise known as body lice. These lice infest the body and lay their eggs in the seams of our clothes and move to our body. The most common areas involved are the neck, trunk, and thighs. The last one is pediculosis pubis, which is caused by pubic or crab lice. Compared to pediculosis corporis, which may affect our whole body, these are more localized in the groin area, but can also appear in the hairs of the chest, under the armpit, beard, or eyelashes. How can I get these lice? These lice are transmitted by having direct contact with somebody who has a lice infestation or coming in contact with their items, such as combs, brushes, wigs, hats, or beddings. Things you can do to prevent this is avoid coming into contact with the infected person or their objects, perform good personal hygiene, wash clothes and bedding frequently, and also teaching your children to avoid activities that may spread head lice, such as avoiding head-to-head contact. Signs and symptoms to look out for are with head lice, there is intensive itch on the back of our scalp, and nits may become noticeable. As you can see on the picture on your upper right hand, you can see how the nits are attached to the hair follicles in our head. A rash can also appear on our scalp. And for the body lice, some symptoms are tiny red points that will appear on our body, along with an intense itch. Signs and symptoms for pubic or crab lice include itchiness as well. However, it might become more intense at night. You might also see black or reddish brown dots, which is their poop. This can be seen on the base of our hair or under clothing. You might also see gray, blue pigmented spots on the trunk, thighs, or armpits. This is a result of the lice saliva coming in contact with the bilirubin in our body. How do I know it's lice that's infecting my body? Schedule an appointment with your healthcare provider so he can perform a physical examination and get you started on the treatment. However, if pubic or crab lice is suspected, then some STI testings will be done.
Thank you, Cassandra, for all that information. Now that we know what the signs and symptoms are, as well as how to diagnose someone, the next important set of information is how to treat it. In this case, the treatment plan consists of two options. The first option is over-the-counter pediculicides. The ones containing either pyrethrin or permethrin are most commonly recommended. These agents should kill the lice and nits. However, if the lice develop pesticide resistance, then we have to go with option 2. Option 2 is when you mechanically remove the lice. This involves using a fine long tooth metal lice comb to comb through the hair in sections. This will manually remove the nits. Both options are aimed at killing the parasites. However, if both of these options fail, there is one last resort. If the two previous treatments are ineffective, then Lindane may be prescribed. Lindane is a controversial, highly toxic topical medication that is only used as a second-line agent. Now that we know the treatment, we need to educate the patient. So for patient education, patients who are found to contain lice will be very insecure. So make sure to reassure them that this can happen to anybody and it is not a sign of uncleanliness. Let them know that treatment needs to be started immediately to prevent rapid spread. Additionally, they should let their family and close contacts know that they should be examined for infestation as well. Instruct the patient to disinfect combs and brushes in hot, medicated soapy water. It's important to let them know that even though the shampoos and lotions may kill the nits, they do not remove them. To loosen the nits from their scalps, their hair must be soaked in a solution of equal parts water and vinegar for about 15 minutes. Then comb the hair with a fine-tooth comb and thoroughly rinse or shampoo to mechanically remove the nits. Clothing, linens, and towels should be laundered in hot water and detergent. Clothing that cannot be washed should be dry cleaned or sealed in a plastic bag for 10 days. Again, all the treatments and precautions are to avoid complications, but sometimes they still occur, so now we will go over those. So for complications, we have secondary bacterial infections can occur with scalp lice, resulting in impetigo, furuncles, pustules, crust, and matted hair. Complications of body lice include secondary infection and hyperpigmentation. Most important, body lice may be vectors for rickettsial or other systemic disease. Now that we have all that information, let's go over the nursing diagnosis. Nursing diagnosis, we have impaired skin integrity, manifested by lice feeding on human blood. Signs and symptoms are blackish brown dots. That concludes the nursing diagnosis. Here are the references being used. Feel free to check them out for more information. Thank you for all your time and attention. Bye-bye.